In the name of Allah, the most merciful and beneficent. Today, in this video, we will discuss what is foot and mouth disease. The etiology of this FMD is aphthovirus, which belongs to Picorna variety. It has 7 main serotypes: A, O, C, ACA1, ACA2, SAT1, SAT2, and SAT3. More than subserotypes, due to which it has vaccine failure. Among these, A, O, C are prevalent in all countries, while ACA1 is found in Asia and SAT1, SAT2, and SAT3 in South African territory. Because this is a viral disease and around about 250 kilometers of area in which animals are kept and they inhale air, they may infect it. How this disease is transmitted from animal to animal, from environment to animals, and from animal to human beings. First, inhalation route, ingestion, direct contact, windborne, aerosol, carriers, animals, site of infection, oropharynx. It can survive for 2 years in nasopharynx, and in mammary tissues it persists for 3 to 7 weeks. In all body secretions, excretions like milk, saliva, fecal material, urine, semen, nasal discharge. Maximum concentration is seen in vesicular fluids. Animals affected by FMD disease are sheep, goat, cattle, buffalo, wild deer, and camel. Generally, cloven-hoofed animals suffer from this disease. Are dangerous regarding to the infectivity. If we observe vesicle formation is most of the cases seen on tongue surface, buccal mucosa, muscles, teats, between hooves, interdigital hooves, or coronate area, circular band on the hoof. Now, what are the major clinical findings? The incubation period of this virus on an average is 3 to 6 days, 1 to 7 days developing upon severity. Rapid fall in the milk yield. 2 billion rupees are lost in Pakistan. In Canada, 2 billion Canadian dollars when outbreak is observed. Temperature 104 to 106 Fahrenheit. Animal doesn't like to eat. There is anorexia, painful stomatitis, highly profuse salivation, ropey strings of saliva, smacking of lips, vesicle formation on buccal mucosa, dental pad, tongue surface. When vesicle rupture after 24 hours, then a clear fluid comes out, leaving behind painful surface, which heals within 1 week. Vesicles after oral cavity appear on the feet, in the cleft interdigital space, and on current region, due to which animals show lameness if the vesicles are not treated. Then due to secondary bacterial infection, there will be complete hoof deformities, vesicle formation, and teeth mastitis, and even abortion. In calves, due to myocarditis, there is certain death. Other form of FMD is malignant form of FMD in adults animals, in which acute type, sudden onset, dyspnea, weak and irregular heart rate, convulsions, and death of the animals. And in alimentary signs include diarrhea, dysentery due to enteritis. And later on, there is ascending posterior paralysis, endocrine damage. In case of damage to hypothalamus, and animals start fainting, there is intolerance to tolerate heat. Chronic syndromes characterized by dyspnea, anemia, lack of heat tolerance, and hair on the bodies will grow more faster than normal, and diabetes mellitus may occur. Some others international trading tests like virus neutralization test, complement fixation test, and in sheep and goat, this disease is not severe form, but hooves of the animals are affected. Now the differential diagnosis, because other diseases can have similar diseases symptoms like FMD. Number one, cowpox, because in cowpox vesicles are formed. Number two, vesicular stomatitis. Number three, blue tongue, which is a disease especially in sheep, and tongue is affected. Number four, PPR or rinder pest. PPR is especially profound in sheep and goat, and ulcers on the tongue are observed. Now we will discuss treatment and preventive measures. For treatment, we use polyvalent serum against FMD, AUC, and ACF1 serotype. Especially buffalo serum is used at the dose rate of 50 cc subcut to give passive humoral immunity. For proper prevention of the disease, all the animals should be vaccinated with 6-month interval. Antibiotics like OTC, oxytetracycline, and other cephalosporins can be used, and NSAIDs to relieve the pain. And in this case, steroids should not be used because they can delay the healing or cause immunosuppression. And antipyretics should be used, antibiotics and other fluids therapy, especially in case of diarrhea and there is dehydration, then we use fluid therapy. And these medications should be used up to 4 days. Thank you. I hope you will like this video. Please take care of your animals as we take care of our children.